value framework. And so the way we think about it, if you will, to just remember why it's important to think through these type of steps as you start your programs. Think about the value framework as just a way to start and scale any remote care programs. And the reason why this is important because if you saw my last video, my last live, we talked about this previously that there will be new programs that will be announced that was going to be around remote care programs, right? We already hinted on the ones that they're out there now. We'll talk about them later, but they're going to be more around clinical care workers, right? Social workers looking for help navigating in a hospital setting, looking for different type of folks to help with caregivers. So all these different programs, they're looking outside of the hospital, outside of the doctor's office, and they're finding new programs they can implement to help these programs. And why is this? Because previous value care programs have been so successful, right? And lowering costs of ED visits, helping with patient care. They have viable numbers for that. So the goal now is to start and then start scaling these programs. So you already have the infrastructure in place to continue to grow these programs for the future. Also, there's a proven process to follow with our clients. This is what we follow with our clients. You follow this kind of process, you'll see this results as well. And it's a simple way to remember all the steps as you go through building out your own program. And there's a way to get your organization aligned to execute, right? So it's a simple way to remember. Typically, simplicity scales. So the more simple your message is, then the better it is to scale to your organization and to your culture so they know exactly how to execute effectively when you're not around. And really, that's really what's key. So this framework, hopefully it helps you as you start to think about how you want to build out your programs in your medical office, in your physician group, or in your nurse group as well. So let's get into it. So first one is value-based care focus on better patient outcomes. So all these acronyms, this is a subset. There's other ones like annual wellness visits, transition care management that we didn't cover on this one. But as you can see, these different monitoring management programs, there's a lot of them, right? And we call them the 3-letter acronyms from CCM to RPM, PCM, BHI. Goal here is to understand that these programs are about ensuring patients get healthy, right? Ensuring that they stay healthy. And so really understanding how they work and how they manage. And like I said, there's going to be more. I think by the last count, there's probably going to be about at least about a total of nine to different programs that are going to be have launched over the last 10 years that CMS is investing in. So take advantage of this. And so this is the time now to understand these programs and the results are there. The patients that are on these programs are getting healthy and staying healthy. So that's why we're seeing more of these programs come to the forefront. So now's the time to stay focused. Next, you want to assess your current patient population, determine the best value-based care programs, right? Typically, you have to make sure they have the qualifying diagnosis and have to be seen in the last 12 months. And in Medicare with secondary insurance is Extreme Plus, right? So you want to make sure that you have the secondary insurance part of that. Because remember, we talked about the consent process, right? Typically, patients who are Medicare, this is a sustainable program and Medicare will take care of that. But what we're seeing is that secondary insurance is so critical to make it something that's for the long term. So if they have that supplemental insurance that helps cover those copays, that's going to be key, right? That way it makes the program attainable for most patients, right? And also you want to make sure they're seen in the last 12 months. And that's really super key because think about it. You want to make sure you have that relationship that's already established, even if they're a new patient. And that's typically a great time to do their annual wellness visit, right? To make sure that they're taken care of and go through the process. So those are some of the things to think about when you look about assessing your current patient populations. You definitely want to leverage experts to implement this program to hundreds of your patients. So, there's a lot of experts out there now. These programs are starting to get bubble up to the forefront. The reason why experts are important because they can give you new insights on these programs. Like I mentioned before, physician fee schedule is constantly changing. They're doing different things with these programs all the time. It's just really important to understand what insights you can gain, best practices on how to just do these programs, right? You may have a certain way you do it in your practice, but working with experts can get you to the next level to really understand how to really implement these at scale. Then also utilizing experts can help you augment pretty exhausted staff, right? Pandemic, we saw record levels of healthcare professionals just experience burnout. And some unfortunately are moving on from the field, right? But if you have mid-levels that need help, definitely bring in the experts. There's nothing wrong with that because that helps them do their job better. And maybe they have a specialty. Maybe this program is something that helps, but ultimately having an expert in is just think of them as an add-on, right, to your current staff so that you can do what you guys do best, which is really take care of the patient. And then you really want to make sure your staff feel at ease so they can do their work, their day job, and these other programs. And that's the way these programs stay sustainable, right? You're not going to run into that issue when you cancel programs because you had no growth, because a lot of times you had exhausted staff. And then finally, look, it's ultimately about faster results, right? If people think time equals money, but unfortunately, it's really time is so much more valuable than money. And what you find out is that if you take a lot of time to implement these programs, they languish there and you probably lose a lot of effort and time and energy. Where if you just put a lot of upfront energy, right? Investments, time, effort, you'll find that you get the results a lot faster and they're more sustainable. And then the ongoing maintenance is not as bad. And so typically that's always the challenge, just making sure that when you go into these programs, really invest the time and effort and you'll get those faster results. And the way you can get those faster results is a coach, right? Or experts. Think about the world-class athletes. They bring in experts to help them get achievement at a world-class level. And so if you're going to do these programs, and we believe every organization should strive to be world-class with their patients, their patients and their populations, then the goal is to ensure that you have the experts in that can help you get to that next level as you implement this new way of working, right? In healthcare, let's be honest, this is a totally new way. Fee for service no longer. This is dealing with sustainable remote care type programs to really help you leverage experts and get you to that next level. Finally, you want to uncover additional opportunities to increase patient retention and in-office visits. You want to catch those patient concerns outside of office, right? I think the statistic is most patients spend 1% of their lives in the hospital or with a doctor. What's the rest of the 99% used for? That's the time to kind of make sure there's constant checkups, right? Especially for, patients who are in Medicare, who are older. You want to catch those concerns because a lot of times they could be forgotten. A lot of them, we mentioned before, are living home alone, or if they have a caregiver, they may have to see them every day. So a lot of needs, healthcare concerns are being left unmet. And so if you catch those outside of the office, then a simple conversation with the patient can get them into the ED beforehand, right? Or help them mitigate issues from maybe things that are maybe non-medical, but can help them with their health long term. Also, the remote conversations can lead to an office visit. We've seen that time and time again. When you're having these conversations with patients, they trust you. And so if you say, "Well, you know what, you may want to just go see the doctor earlier. We see you on schedule in the next 3 months, but let's schedule you in to come in a little bit sooner to see what we can do with those med changes." And I think that's really what's about, really forming these long-term connections with patients so they feel trust you. So a lot of the patients, it's difficult to go to the office, right? Sometimes the planning goes involved, the timing and all that. But if that trust is built up with these communications, with remote conversations, then patients trust that, hey, when you say, hey, it's time to maybe go into the office and talk to us or have a conversation, then that is something that they trust and they will make the effort to do. We've seen it time and time again because ultimately it's about feeling connected to the doctor, right? And so this is that sense, even though the doctor may not be talking to them directly, they do feel that the doctor is aware of their situation. And then more importantly, so when they do see the doctor, maybe like once a year or twice a year, they feel it's not a whole new conversation. Have you been to the doctor's visit and you may feel, yes, you may have seen the doctor for 5, 10 years, but you're seeing him once a year. It's almost like you're having a new conversation. Yes, they can look up meds and some history, but it's, yeah, I told you that last time. This flared up again. Oh, yeah, that's right. Let me write that down. You can avoid a lot of that with some of the patients because now they're having these ongoing conversations that get notated and charted. So now the conversations feel more fluid, right? Because it seemed really like a conversation as opposed to just a one-sided, hey, this is what's going on with me. Oh, I missed that. Let me add that here. It really feels more connected. And then you get a retention with patients who feel like, hey, I'm being heard. I don't just have to, that's why I stay with my doctor for indefinitely. And so those are some things that we've seen. And last but not least, look, goal here is to continue to evaluate consistently so that you get those patient results that you want. Consistent review helps with the improvement. It's been shown time and time again. One of the big things why you need consistent review is insurance is changing all the time. We've seen that time and time again where insurances, even prior to open enrollment, have changed. Patients moved on to different insurance plans, or they may want to try something else. And understanding that is really key, right? So that you can get the results you want from the patients. And if they're different insurances, then you know they probably have different rules around what's acceptable or not. So that's why it's important to evaluate for patient results, seeing what stories come out of this. When you talk to patients, are they getting a benefit out of staying on the program? The purposes that they align to at the beginning, are they still the same? So they can continue to talk about the goals of what they want to do with their health. And then ultimately, if you don't measure, anything you don't measure will not improve. And this is key. It's the way to understand exactly what needs to be changed. Likewise, when you have young children, you're constantly measuring how tall they're getting because it's time to get a new pair of shoes. Likewise, people behavior change if they get positive feedback. And that positive feedback can be in terms of understanding that the numbers are getting lower. They can breathe easier and it's quantifiable. So now it improves. They say, okay, I'm feeling better about myself. Let me do more of that. And then you have a self-fulfilling loop of patient better behavior and change. And ultimately that produces a better organization and program for your practice because now patients are telling other patients about the program and saying the benefits they're getting out of it. And so really what this ultimately was about, right? Making sure you provide the best patient care and evaluate these programs monthly can get you there. If you like this, this is a free kind of framework you can utilize. We call it value. It stands for the value-based care programs focus on better patient outcomes. Assess your current patient population, determine the best VPC or value-based care programs. You want to leverage your experts, implement this program to hundreds of your patients, uncover additional opportunities to increase patient retention and in-office visits. And then finally, evaluate monthly for patient results. So if you remember that value acronym, get you to the place where you need to be to grow your organization in these new virtual care programs and produce the value you need for your patients and for your practice. Hope you enjoyed this training and be on the lookout for our next monthly training or webinar. We should have one at the end of this month. But again, thank you for your time and enjoy the rest of your lunch. Enjoy your weekend. Take care.